Hello, today Crystal and myself, Rayanne, will be presenting on Williams syndrome. What is Williams syndrome? So it's a rare neurodevelopmental disorder that is characterized by growth delays. What causes WS is a microdeletion of approximately 26 genes on chromosome 7 that leads to the suppression of elastin and can be diagnosed by using a test called FISH. Some physical characteristics may be seen in a physical phenotype is a short in stature, an elf-like face, microcephaly, a wide mouth, small and upturned nose, malar flattening, wide dental spacing, or widely spaced eyes. And commonly, those with WS are highly sociable in nature.
Okay, so who is Jax? Jax is a 7-year-old boy who is diagnosed with Williams syndrome. He's in a Mexican-American family dynamic. He has a 3-year-old brother named Maddox and a mom and dad. His family interest is they're very interested in musical talents. They attend church every Sunday. They enjoy traveling, going to amusement park and outdoor activities. They're an upper middle class household, and the dad is currently the sole provider for the family. Jax himself is very interested in Marvel characters such as Spider-Man and Loki. He enjoys playing music, meeting new people, interacting with others, and playing outside. So what's a little clinical picture on Jax? So some of his impairments with Williams syndrome include a mild intellectual disability. He does have difficulty sustaining attention. He is easily distracted with tasks that he's in. He has difficulties copying letters, shapes, and numbers, difficulties with constructive play, such as building Legos or magnet tiles. He has difficulty climbing jungle gym equipment because he tends to have balance and coordination difficulties. He does require dressing with skills such as buttoning, zippers, and shoelaces. He often becomes anxious in situations where there's potential for loud noises, so this is concerning for the amusement park setting. He does have difficulty recognizing social cues. He has difficulty understanding personal boundaries, so he'll often offer people hugs or try to hold hands with inappropriate people. He has difficulty recognizing appropriate conversations with individuals, and he tends to wander off and overshare some information, such as giving out his address and things like that, which often causes some stress for his parents.
Okay, some of the affected client factors, they are going to include specific mental functions. So first off, due to his mild intellectual disability, they are impacting higher cognitive levels, specifically metacognition, concept formation, executive functions, practice, and judgment. Also, he has difficulty with attention, so he's very easily distracted, and emotions. He has difficulty displaying and regulating emotions appropriately. Some other client factors that are impacted are global mental functions, such as temperament and personality. He's very extroverted and overly self-expressive, which is a common trait in those with WS. There's also some impairments in sensory functions, such as visual function impairments. With our specific client, he has experienced difficulties with visual acuity, proprioceptive functions, and vestibular functions, which can be seen in the way he navigates his school environment and within the OT out clinic environment as well. Also, there are psychosocial impairments. So his highly sociable nature and difficulty understanding receptive language has an increased risk for bullying and interaction with strangers. Also, those with WS may experience phobias. It just depends on that individual. For Jax, he has phobias of loud noises, which is common in those with WS. Also, some other phobias include needles, such as getting shots or interacting with medical clientele. So just be aware of that. And there's also a familial impact. So it can cause parent depression, which will lead to less effective parenting and poor maternal physical health.
Okay, so what does this look like for the role of OT in specifically Jack's case? So currently, as we described, Jax, he is very hypersocial and tends to wander off. So something we do want to address is what is called, or an intervention we want to incorporate is a privacy circle. So as an OT, it's important to address his hypersocial characteristics. For Jax, he definitely has difficulty recognizing those social cues, understanding personal boundaries of who he is able to hug, kiss, and hold hands with, recognizing appropriate conversations with strangers and people who are important to him. He has, as we stated earlier, he tends to wander off and share inappropriate information with strangers. So as an OT, we definitely want to look at the social participation aspect. So looking at his social conventions, personal safety, his social relationships, self-efficacy, coping skills, and his temperament and emotional reactivity. So a privacy circle is, as you can see here in this picture, you're going to have the child in the center, and on the outside rings, you're going to have family, friends, strangers, neighbors, anywhere between 8 to 10 individuals here. And what you're going to do with the child is have them identify appropriate conversations that they can hold with these individuals that are within these different circles. So for our intervention, we took Jax and had him try to identify these and who actually falls within his family category. So who he's able to hug, hold hands with, and tell him his address and things like that. So kind of broke down those. So this is definitely useful for Jax since he does have decreased social awareness, especially in particular areas. But overall, an outcome that we do want to see for Jax is for him to be able to recognize social cues, identify what appropriate conversations he can have with these individuals, and definitely recognizing personal boundaries.
Okay, an additional role for occupational therapy is going to be addressing education, specifically informal education participation, since Jack is within our outpatient clinic. And some of those are going to be addressing components that are designed to support the development of performance skills and to enhance occupational engagement as a student at school. So we'll be working on those underlying factors to give him support within school. It's also within the role of OT to administer specific assessments. So for example, we would be administering the developmental test of visual perception, the 3rd edition. And then this is going to be an appropriate test because it will assess the areas of visual perception he's having difficulty with and how they are impacting his role as a student. And we will see later on that he's having difficulty copying shapes, lines, and numbers. So it will provide, it'll also provide information on other activities that require those integration of VP skills as well, such as building with blocks or magnetiles or fine motor skills. All right, so another role for occupational therapists is to focus on play. We know that play is very important for a child and is one of their main occupations. We really want to encourage different types of play, specifically using magnetiles. We will be addressing constructive play, and this is going to be important for problem-solving skills, flexible thinking, the ability to use materials appropriately, and for him to design something and actually make it become a reality. It's going to also encourage his creativity and while addressing those skills such as practices that he'll need to complete the activity successful. Also, this is really going to challenge areas of visual perception. Figure ground, as you can see in the picture, it's going to require figure ground skills, visual closure, form constancy, visual discrimination, and visual spatial relations especially. And also within this context, we are going to be addressing his ability to sustain attention, haptic perception, and bimanual coordination. And we really want to be able to address these components within various tasks. That way he's able to generalize his skills from the clinic over into his home environment and his school environment. And that is our ideal outcome for Jax. So our 3 interventions you will see start off with a privacy circle to address personal safety and personal space, and we'll give a various amount of scenarios for Jax to practice with. Our second activity is going to be a handwriting activity that is client-centered to allow him to stay motivated and to enjoy a handwriting activity. And the third intervention will be building with magnetiles, which will also be client-centered, and we're relating it back to his favorite superheroes. And here are our references. We hope you enjoy our intervention session. Thank you.